recording, a citywide public mental health partnership which sets out to ensure that all Londoners have an equal opportunity for good mental health and well-being. She leads research and evaluation on crisis response and recovery, trauma-informed practice, participatory action research, and workplace mental health. With that, I'll hand it over to you, Bessie.
Great, thanks for that introduction, Madison. Hi, everyone. Let me just get my slides up. Great. Assuming we all can see this, so I'll just get started. Thank you for that introduction. As Madison said, I'm Bessie. I am from Thrive London, and I'm going to be leading us today on a discussion around how human-centered are our research practices. So just a quick introduction as to who Thrive London are and what we do. Thrive London is a citywide public mental health partnership with the aim of ensuring that all Londoners have an equal opportunity for good mental health and well-being. We are launched publicly by the Mayor of London and the London Health Board partners back in 2017, and we have evolved and grown significantly in the past 5 years. We have 4 guiding principles within our work, the first of which is equity, so ensuring that proportionate universalism and intersectionality underpin all action. The second of which is participation, which I'll be going into a bit today. So we aim to channel participatory energy through a balance of both bottom-up and top-down approaches. The third of which is wider determinants of health, so prioritizing activities and conducting research which show how the wider determinants of health impact Londoners' opportunity for positive mental health and well-being. And the last of which is complex systems. So we drive outcomes across 3 broad levels: individuals, communities, and systems, with the aim of improving mental health and well-being within London. Thrive London has a really unique place within the system. Our place is to embrace change and enable an environment of transformation and growth for public mental health in London by driving the enablers that I just mentioned. We do this by providing an independent and diverse voice to the health and care system, as well to research and academic partners. We advocate on behalf of those with lived experiences of poor mental health and inequality, and provide a link through trusted relationships with individuals and communities. We've built this trust over the past 5 years through very meaningful, widespread engagement, through accessing new and diverse perspectives, and strengthening social ties with communities. Now, we have a research and evaluation team within Thrive London, which is what I sit in, and this team has 4 main aims, the first of which is to challenge assumptions and power relations that exist within the system and within research. The second is to test and create new models for working and identifying solutions within public mental health. The third of which is to innovate, so ensuring that Thrive London is a program of excellence and innovation for public mental health. And then the last of which, and most importantly, is change. So everything we do is with the aim of developing greater capacity for effective action in order to drive equity and improve mental health. So moving on, I'm going to open this up to the room by saying, what do we mean when we say human-centered research? So we have a Mentimeter, which you should be able to access by showing the QR code that's up on the screen. I think I'm going to stop sharing my slides now as well, and Verity might put up the Mentimeter. Yes. Great, so I think this is the short answer. There isn't one real definition with human-centered research, so we wanted to open it up to the room and see what the broad understanding was here. So I'll give it a minute or two. People at the heart of our work, ethical, yep, definitely. Research that begins from the priorities of the beneficiaries of the research. Ethical, see a theme here. People are part of the process as well as the outcome. Respect and dignity for participants. People are not numbers, that's a really important one. Person-centered outcomes, compassionate. Yeah, definitely. I mean, I see here a lot of people are talking about ethics and about respecting the people that the research is about. That's something we will be discussing later. Participation, that is one of the core enablers of human-centered research. Looking at people as human beings, definitely prioritizing the people involved in the research. Flexibility, yep. There might be more answers if we scroll down. Thanks. Yeah, absolutely. So all of these are exactly right. We'll be talking about this a bit more, but in the interest of time, I think I'll go back to my slides. Great. So moving on to the next slide. What we'll be going through very briefly are 4 major considerations that we should take into account when we're talking about human-centered research. So the first consideration here is participation, which was something that's a couple of people mentioned in their definitions. So we define participation as the active involvement of people in formal or informal research, activities, programs, and or discussions in order to bring about planned change or improvements. And so what this does is it directly addresses the marginalization and powerlessness that's caused by entrenched health inequalities, and it provides insights from intersectional and marginalized groups, helping to shift the power balance from top-down to bottom-up approaches. This aims to empower those affected by health inequities to influence change through active involvement in the entire research process. It treats people with lived experience as equal researchers throughout the entirety of the project. So we're not talking about just in the data collection phase, we're talking about from the very onset of the process, from the design, the study design, from the collection to the analysis, and then through to the evaluation and any considerations or conclusions that are drawn. This also challenges assumptions and power relations. It works to expand data and intelligence sources that often lack representative and granular information on the experiences and needs of London's diverse and intersectional communities. And then also it supports the professional development and personal empowerment of those with lived experience. So it's working to give them the skills and to make them more resilient and empower them to kind of go back into their communities and affect change. The second consideration that we'll be discussing is around remuneration. So it is very essential that all people who are involved in research have equal opportunity to receive compensation for their time, efforts, and contributions. This is to acknowledge that all contributions to research are of equal value and importance in the production of knowledge, resources, and interventions. This also seeks to remove barriers to participation. So it allows people that otherwise might not have been able to participate in the research process, whether it be due to financial restrictions or to childcare needs or transportation costs. This allows them to be able to participate fully. This also addresses power imbalances between the researcher and research participants or people with lived experience by showing that researchers do value their expertise and their time and their effort. This also encourages, again, a wide and diverse range of community members to participate by just removing barriers to participation. And we can think of remuneration beyond just financial compensation. This can also be involved in opportunities to build social networks and to access resources such as employment, education, training, and learning new skills. So we can help support people involved in the project. We can support their personal and professional development and their self-empowerment within the research process. The third consideration here is all around feedback loops. So this is ensuring that as researchers, throughout the entirety of the research process, we are feeding back to those who have given their time, who have given their expertise, and who have given us their insights in order to ensure that we are staying on track and that we are not losing their trust. So this helps to build trust between study participants and researchers. It also ensures that findings were appropriately gathered. So by going back and checking, is this what you said? Is this what you meant? This is what we were planning on doing next. Does that seem right? This just helps to ensure that we are staying accurate to the insights that were given to us. This helps to challenge assumptions held by the researchers. So it kind of helps to remove any cultural barriers that there may be, any assumptions that we have around definitions of mental health, of public health, of whatever it may be that you're researching. And this also helps to encourage action-oriented outputs. So something that we do within Thrive London is ensure that all of our research is with the aim of affecting positive social change. I think a lot of marginalized communities may have survey fatigue, may have study fatigue, and are tired of researchers coming in, asking them to share their stories and then kind of taking it away and not doing anything with it. So this is by providing feedback loops, it encourages us to stay focused on what the aim of the research is. We need to think about ethical implications within this. So participants should be made to feel that their contribution has led to a result that involves them and that promises made by the researchers were held. So transparency is really, really key here. We need to be transparent about what we are planning on doing with their data, how we hold on to the data, and being mindful that the relationships we build may be put at risk if we don't demonstrate what we are doing with their insights and if we don't stay true to that. I think within this transparency, it's also really important to show where the limitations of our power is in terms of what we are able to affect with change. You may go in and engage with people with lived experience, and they may be expecting complete system reform as a result of that. So it's really important as researchers for us to clearly communicate what we are going to do, who we are going to engage with, who we are bringing these conclusions to, and what we think could happen. And it's really important to note that this is a continuous process. So it's not that we are just going and feeding back once. Throughout the entirety of the research project, we need to be ongoing in communication with people, sharing back. Then the last consideration here is around power, which I've kind of discussed in the previous three considerations. In Thrive London, we aim to encourage a cultural shift where there exists no hierarchy in terms of knowledge and expertise. So in this, researchers must be conscious of using their power in the academic world in order to share power with those who are traditionally excluded, to increase accessibility for those outside of academia or for those who may not have previously engaged in academia, and also to help dismantle power structures that serve as barriers. So within this, we do have to acknowledge that as researchers, you will have certain areas of expertise that maybe people with lived experience, peer researchers, or study participants may not have, but we need to acknowledge that they also have areas of expertise that you as a researcher don't have. And you need to share your power with them in order for them to bring those areas of expertise to light. So there's just a really great quote around this, which is that participation takes place in an unequal world. If we don't acknowledge and engage with these power inequalities, there's a danger that participation will increase them. Oh, looks like my sheet, there we are. So kind of drawing together all four of these considerations, something that we like to utilize within Thrive London is what's called participatory action research, or PAR for short. And so the name is very self-explanatory. Kind of what it does is said. So participatory, this involves people with lived experience and professionals who support them as equal researchers throughout the entirety of the project, aiming to shift and share power. The action part is that it's focused on action and change at the foundation of the work. So we're seeking to make positive social changes in a collaborative and sustainable way. And then lastly, this is research. We are aiming to co-produce findings with those who have lived experience, amplify the voices that are lesser heard, and make research more accessible and valuable to the community that it's focused on. So I'm not going to go through this framework in depth, but this is just something to show that this is quite an iterative process. Within PAR, you go through many phases of plan, act, observe, and reflect, ensuring that the action stays really relevant throughout, ensuring that there's constant feedback loops, and that we are sharing power and encouraging participation. Then lastly, before we get into the discussion, just to share a few examples of human-centered research. So PAR in practice. Back in 2021, Thrive London worked in partnership with Tony B. Hall, which is a really great community organization based in East London. And we delivered a participatory action research project that's titled Pandemic Stories. And this was led by people with lived experience of surviving the pandemic in the hardest of circumstances. So we worked with those who were disproportionately affected by the COVID-19 crisis, and they helped to design a survey to collect data, to analyze this data, and to draw conclusions. And this produced policy recommendations for a fair future that were shared with policymakers and change makers in order to effect positive social change. There's a link to this in these slides, which will be shared with you after this conversation if you're interested in learning more about this study. And then the second example is kind of multiple examples, but it's just to show around arts-based engagement and research that there are alternative methods to data collection and to research presentation that could help, again, to increase accessibility and reduce barriers between the public and the system. And so what this does is it kind of encourages art as the expression of creative skill and imagination, and using it as a mechanism to kind of produce findings and to share insights, whether it be through painting, through spoken word, poetry, journaling, kind of anything you can think of, photography. So this can be used both as data collection and then also to present data to change makers. And it holds emotional power with the ability to influence how people think and feel. So these are just a few examples of when Thrive London has done arts-based engagement and research. On the right here, there are 2 different murals that we've created in partnership with people with lived experience. And then on the left there's what's called immersive wishing trees, which we've used for our World Mental Health Day, where people can write down what they would like to kind of be shared. And so before we move on to the discussion, does anyone have any immediate questions or anything? No? Great. So I hope I'm just still sharing my screen. But what we are going to do next for the next, I believe, 20 to 25 minutes is we're going to break out into breakout rooms. And each breakout room will have these 6 questions on a Jamboard. So you can access the Jamboards. I believe a link will be put into the chat. And so when you're put into a breakout room, pay attention to what number you're put into, because that's the Jamboard page that you will access. And so all 6 of these questions, you don't have to get through all 6. These are meant as conversation starters or as prompts. If one question kind of jumps out to the group, they can use that question, discuss it for the entirety of the time. Or if you'd like to work your way through all 6, that's absolutely fine as well. If you don't like any of the questions, feel free to just have a conversation. There will be myself and a couple of other colleagues that will be kind of jumping between breakout rooms to help facilitate discussion and just to kind of keep the conversation going. But I think that's it from me for right now.
Hi, everyone. Welcome back from the breakout rooms. I think we're going to be transitioning to a sort of feedback and discussion section, again, led by Bessie. So I'll let you take over when you're ready, Bessie.
Great. Thanks, Madison. Hope everyone had a great conversation in the last 15, 20 minutes. I think we'll just kind of go in order of breakout rooms. So if anyone from the first breakout room would like to share anything you guys discussed, any questions you want to bring to the larger group.
I've finished group 1 with me asking what the best way of respectfully disagreeing with people, like when you have people who are like academic researchers and people who are coming from lived experience and all the expertise they have. Sometimes I feel that like there's lots of people deferring to one another, whereas actually it would be nice to get a really productive discussion where people can disagree, but they don't feel that like, you know, they're talking down to people or invalidating their experience. So I started asking that at the end of a group, and then we got a really interesting answer. And then we came to the breakout room straight away. But I'm just really interested in people's thoughts on how we do that well.
I guess something that immediately came to mind for me, because I agree it's really important to allow people to feel like they have the power to do that. And so it's from the onset of the research process or of your partnership together, kind of encouraging people to set ground rules of what the process is going to be like, encouraging people to share their expertise and creating an environment where people feel like they're able to share. So again, that's about shifting power from the researcher to participants, and it's about sharing power equally throughout the room. Anyone else have anything to add?
I can jump in. Sorry, I can't find the hand up thing. But yeah, that's something we've definitely experienced in Thrive London as well. And it's really challenging. I've been personally really challenged by it, I think, because sometimes we come from the health system, like we said, we are a challenging friend to the system, but we are part of a problematic structure as well, where people have been treated in like sometimes poor ways. And I think one of our reflections from a project where we we use the principles of power was being one, going into the project really clear on our own boundaries and setting the expectations. So we could create room for the challenge and like uncomfortable conversations, because life experiences are often really challenging. But then creating that space in an emotionally safe way, but then also being able to circle back on where we are in terms of expectations and boundaries. So kind of setting that off from the beginning. So you're still creating space for the conversation, but you're getting to kind of the next stage together. Like, because we won't always have an answer for to the questions, but it's still important to create the space and find other avenues to kind of resolve or kind of get through the problem. I hope that makes sense without using any like direct example.
It might be, we had a suggestion to go question by question, which may work well. So something my breakout room discussed a lot was around the limitations and ethical considerations at play when discussing human-centered approaches to research. So not to put anyone from my group on the spot, but does anyone have any things that they want to feed back in terms of our discussion?
I'll say briefly. Yeah, just the themes that come up a lot in the work that we do in the centre, just about the sort of traditional ethical sort of agreed principles of ethics and how they increasingly sit in tension with the evolution of participatory methods. So things like anonymity can sit in tension with people wanting to be heard and seen, and needing to have your protocol all pinned down up front doesn't really work well within sort of evolving responsive participatory methods where the project might shift as time goes on. And then the sort of time frames as well, including things like people on fixed term contracts where you're wanting to build relationships and have a longer term relationship with the community, but your job runs out, and then how does that leave the participants and the researchers emotionally? Yeah, so all kinds of ways in which participatory methods don't sit very well with sort of traditional and quite embedded academic structures.
Can I just jump in, although I'm not part of that group? Because I think something that added to that from our group, we were group 4, was connected to funding and the funders, that also here the structures are not, even though funders increasingly want, co-production, want participatory action, but then they give you such a short time frame to actually co-produce the application itself, which makes it almost impossible. And at the same time, if you don't get the money, no participatory action research. So it's very difficult also here to sort of work within these structures while trying to be creative to make them as malleable, as fair as possible. But they're sort of quite stiff structures, just like the ethics.
Just very quickly to add to what Hannah was saying, I think it is incredibly difficult with existing funding systems, and you have to be very creative, I think, about trying to find ways to ensure you can, particularly with the funding of during a project of ensuring lots of people are involved. Just to flag, there is a lot of work going on, which myself and Charlotte Woodhead in the centre are involved in, which is trying to actually feed into what's happening in Wellcome and UKRI around particularly young people's involvement in research. So if there are particular things you want me to include, and we'll be co-producing with young people and other stakeholders recommendations for those funders, do shout. I'm happy to feed those into the process as we go along. But just to say, there is actually hopefully some actual action happening in those spaces.
Thanks, Helen. That's inspiring and hopeful. Clea?
Yeah, I guess just to pick up on what Hannah was saying as well, I think we also talked about just how the kind of the structures of power, whether that's the academic institutions or the funders, also the extent to which they do or do not recognize other forms of knowledge, other ways of knowing. So there's kind of that lip service about what's recognized and how we want to recognize, but you don't necessarily see the follow through in terms of, is your team credible if you don't have all of the academic check marks, but the people whose knowledge we want to draw on do not necessarily have all of those credentials in the same way.
Yeah, absolutely. Helen Daly.
Sorry, I found my hand. But very quickly, a frustration is that sometimes the funding doesn't start until the case has been submitted. So it's really unfair to expect people to co-produce an application out of their goodness of their own heart, and that's a challenge that we have had big time.
Yeah, definitely. So I guess my question back to all of you is, what are some ways in which we can challenge the system to make reform? So it's great that Helen Fish is working on this application with Welcome, but are there other ways that we can kind of push back to funders, to ethics boards, etc., to try and include more of these considerations from the onset of research? Madison?
Yeah, I can kick this one off by sort of referencing a related subject that my group was talking a lot about, which was power and the naming of power. I think the first step in sort of pushing back is encouraging or demanding rather that funders and other groups acknowledge that the power that they have and the way that that power separates them from the real material needs of the communities that they're claiming to represent or to do research with or things like that. We talked about, there was a great quote around power can make us blind, and how being direct with the people we're meeting with around this can be quite important.
Yeah, I think one that I'm not sure to what extent this is answering the question, but in my experience in all the sort of co-production work that I do, whether it's here or in Palestine, the quality of the work at the end of the day is just so much better. And it's really in a really stark way. And I wish if that was recognized by funders in our institution, that we actually produce better quality work if we created and worked in structures that are fair and allow people to really contribute, where we are all contributors to knowledge, then I think, how can we not change the structures? How can we not change how we do things if that would lead to higher quality research, impactful outputs, and possibly change? So I think if that narrative could come through more clearly, that would make a big difference in my view. How to do this is, of course, super challenging, and I don't have the answer to that, but it's this kind of pushing that also Helen and others are, of course, doing.
Yeah, absolutely. So it's about how we demonstrate that case for change and the value added by utilizing participation. Conscious that Madison, I see you're unmuted.
Yep, I was just going to flag a couple of the comments in the chat around using creative approaches, and how people like artists who might not traditionally be seen as people involved in research or in academic spaces are often great at holding and navigating uncomfortable spaces. And Helen following up saying that NIHR Research Design Services does have some funds to support pre-submission involvement that researchers can apply for, which a couple of links have been dropped in the chat to follow on from that comment.
That's great. Yeah. I mean, again, on the artist point, kind of brings us back to the arts-based engagement with research. So utilizing these creative methods to encourage people, again, this might help with if there's conflict within the room, if there's power imbalances, people can feel like their voice is heard more through art, maybe than through more traditional methods of data collection. Conscious that we only have 5 minutes left. Does anyone have any final thoughts? And if not, we have one final question on the Menti for you before we wrap up. Great. Could I ask Verity, I think, to put up? Great, thank you. So again, this is on the same QR code, and I don't know if we can post the link again in the chat. There it is. Yeah. So this is going to generate a word cloud. So one word responses, and feel free, I think you can input multiple responses, but just to kind of see how our shared understanding of human-centered research has morphed and changed throughout this session. Seeing some great words here. A paradigm shift, absolutely. Important, community-driven, participatory. Essential, yeah. Ethical. Ooh, an interesting one, unrealistic. Maybe, yeah, in the kind of structures in which we exist right now might be a bit unrealistic, challenging. Great. Well, if anyone has any final words to add, feel free to, but I think I will hand back to Madison to close the session then. Thank you all so much.
Thanks everyone for a really engaging session. We're actually going to ask you for one last bit of engagement today, which is to complete a quick poll, which should be popping up on your screens around how you found today's session. This will be used to guide future sessions and to just get a general feel for what you all liked and didn't like today. Just a couple closing thoughts. It was really great to hear from you all about human-centered research practices, to reflect on participation, remuneration, feedback loops, and the conversations around power that we had. And quite frankly, just to share space with people who are working in similar fields and meet some new faces today. So many thanks for your participation today, and hope to see you at a future session. We'll be following up with slides and recording potentially. So keep an eye out from us. Thank you. Bye, everyone.